Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. We are discussing trauma of the spine. Here we have a 25 years old male patient who has the history of old trauma. We can see there is superior end plate compression fracture of L1 vertebra. There is mild reduction in the height of anterior half of its body. Subtle marrow changes are also appreciated under superior end plate on both T1 and T2 weighted sequences. We can see that in spite of this, there is normal alignment of lumbosacral vertebrae, while we can also see bony canal is capacious throughout the lumbosacral region, and visualized portion of the conus and adjacent lower dorsal cord is unremarkable. Similarly, we see that there is no abnormal disc bulge or disc protrusion at this level. So this is a mild degree of superior end plate compression fracture with capacious bony canal and normal alignment of the lumbosacral vertebrae. There is no soft compressive disc disease at the site of trauma, although there is tiny disc bulge at L5S1 level, which is insignificant, and there is no evidence of discovertebral osteomyelitis. Now we see another case. This is 75 years old female patient. We see that there is significant reduction in the height of upper three lumbar vertebrae. Intervening discs are unremarkable, and we can see a bright line sign under superior end plate of L3 vertebra, which is typical for osteoporotic compression fractures. So these three vertebrae represents osteoporotic compression fractures. Tiny bulge of upper portion of posterior body line is noted in L1 vertebra, and in spite of these changes, we see the bony canal posteriorly is capacious, and lower dorsal cord including conus is unremarkable. There is no soft compressive disc disease at upper 3 disc level, although tiny disc bulge is noted in L4-5 disc. Similarly, there is mild kyphotic deformity at dorsolumbar junction because of compression fracture of L1 vertebra, and here we see low signal intensity areas within the vertebral bodies, both on T1 and T2 weighted sequences, which are the sequelae of previous vertebroplasty. So this is an example of multi-level osteoporotic compression fractures. In spite of all these changes, bony canal is capacious, and there is no evidence of discovertebral osteomyelitis. Now let's see a patient who presented with acute trauma. This is sagittal T1 and T2 weighted sequence, and we see there is wedge compression fracture of D11 vertebra, while interior displacement of D10 over D11 is seen, suggesting grade 1 to 2 spondylolisthesis. And here we see that there is facet dislocation and locking of the facet joints. Facet joint is locked. Similarly, we can see on other side locking of the facet joint is noted on both sides. So this is bilateral facet dislocation with locked facet joint, and we see that there is severe spinal canal stenosis posteriorly at this level with almost complete cord transaction. Here we can see that abnormal increased signals are noted in anterior and posterior paraspinal soft tissues, suggesting post-traumatic inflammatory changes. Bone bruising and marrow edema is appreciated in D8, 9, D10 and D11 vertebrae. We can also proceed with targeted CT scan for proper assessment of facet joints and regions of pars intraarticularis at this level. Degenerative changes are noted in lower 3 lumbar disc levels, where tiny non-compressive degenerative disc bulges are noted in intervening discs. So this is an example of acute trauma with cord transection and grade 2 spondylolisthesis with bilateral facet dislocation and locking. So here we can see all three cases. This is a young patient, 25 years old, having mild superior end plate compression fracture. Surrounding soft tissue is unremarkable. Bony canal is capacious with normal cord and conus. This is 75 years old patient showing multiple osteoporotic compression fractures. These are old injuries. Surrounding soft tissue is unremarkable. Superior end plate bright line sign is evident, suggesting osteoporotic background and osteoporotic compression fracture. In spite of degenerative changes and osteoporotic compression fracture, bony canal is capacious with normal lower dorsal cord and conus. Here we can see this is a case of acute trauma, although patient is 60 years old, but we can see soft tissue edema is appreciated in pre and paravertebral spaces anteriorly and posteriorly, while we can see there is bone bruising in D8, 9, 10 and 11 vertebrae with wedge compression fracture, and there is anterior displacement of D10 over D11, suggesting grade 1 to 2 spondylolisthesis with bilateral facet dislocation and facet locking. Extensive canal stenosis with almost total cord transection is noted at this level. Mild degenerative changes are noted in lower lumbar spine. So in this case we can see acute changes in the shape of soft tissue and marrow edema. Thank you very much. Assalamu alaikum warahmatullah.